Good day, everyone. Women and girls all over the world face greater risk and vulnerability in this time of the COVID-19 crisis. In the Philippines, the government has strategized to contain the virus by implementing the enhanced community quarantine or the ECQ in areas where the number of those infected with coronavirus is high. Aside from providing PPEs to our frontliners, the law provides the President of the Philippines the power to implement temporary emergency measures to respond to the crisis brought about by the COVID-19, such as adopting and implementing measures which are based on World Health Organization guidelines and best practices to prevent or suppress further transmission and spread of COVID-19 through education, detection, protection, and treatment. Providing all public health workers with COVID-19 special risk allowance, directing the Philippine Health Insurance Corporation to shoulder all medical expenses of public and private health workers related to the exposure of COVID-19 or any work-related injury or disease during the pandemic emergency. Providing a compensation of 100,000 pesos to public and private health workers who contract severe COVID-19 infection while performing their duties, and a compensation amounting to 1 million pesos shall be given to these health workers who will die because of the virus. Ensuring all LGUs or the local government units adhere to all the rules, the regulations, and directives issued by the national government with respect to this law, as well as implement community quarantine consistent with the standards the national government has laid from. Directing the operation of any privately owned hospitals, medical and health facilities, and other establishments to house health workers. Directing public transportation to ferry our health, emergency, and frontline personnel, as well as other individuals, provided that the management and operation of this enterprise shall still be with the owner. Hiring temporary human resources for health, or what we call the HRH, who shall receive appropriate compensation, allowances, and hazard pay to complement or supplement the current health workforce or to man the temporary medical facilities under Republic Act 11469. Cash subsidies provided under the Social Amelioration Program, or what we call SAP, for 18 million Filipinos who belong to low-income families whose lives are greatly affected by the ECQ for basic needs such as food, medicine, and toiletries. Women are not barred from engaging in economic activities since essential goods remain unhampered as per Republic Act 11469 and so long as we follow health protocols. The Department of Foreign Affairs, or the DFA, provides assistance to OFWs, or our overseas Filipino workers who are being repatriated because of the COVID-19 crisis. DFA also provides food for those repatriated, for those who are stranded in lockdown countries. Likewise, the PCW is working closely with UN Women in International Labour Organization, or ILO, on the Safe and Fair Project for Migrant Women. These repatriated OFWs, who are land-based workers and whose jobs were greatly affected by the pandemic, were sent home by their respective employers in coordination with DFA. It's also their agencies that pay for their fare to come home. The Department of Labor and Employment, or the DOLE, will also provide a one-time financial assistance of 10,000 pesos under its DOLE AKAP for OFWs program, which will be given to land-based and sea-based overseas Filipino workers whose employment were affected by the COVID-19 global pandemic. Under the department's omnibus guidelines in the implementation of the Social Amelioration Program, OFWs or Overseas Filipinos in distress can likewise avail of the SAP since they are considered as vulnerable members of the community and are amongst the affected by the ECQ. Under the guidelines of PCW's Memorandum Circular Number 3, Series of 2020, dated April 27, 2020, entitled Adjustment and or Implementation of the Fiscal Year 2020 Gender and Development Plan and Budget in view of the Coronavirus Disease 2019 situation, it states there on 4.1.5, for agencies with mandates related to addressing gender-based violence, ensure victim survivors access to legal and various support services by adapting existing mechanisms to the crisis context. For example, dedicated hotlines for reporting gender-based violence areas, online counseling, and repurposing spaces to expand shelters for GBV survivors. You can see now on your screen all the different hotline numbers of the various agencies, the government agencies working hand in hand to address GBV. The Philippine government, through the PCW, is currently discussing with Oxfam and Pambansang Koalisyon ng Kababaihan sa Kanayunan, or the PKKK, or what we call the National Rural Women Coalition, in coming up with a program that addresses unpaid care work, or UCW, during the lockdown. A care policy for women is highly recommended, prioritizing an investment in quality, accessible, and affordable public services and infrastructure. This can help ease the burden of heavy and unequal unpaid care and domestic work, or the UCW, and contribute to the attainment of multiple sustainable development goals. Thank you.